Now in this training segment, we're going to cover how to incorporate 2 rescuers for a child in CPR for the healthcare professional. We're still going to make sure the scene is safe, our gloves are on, whether we have a rescue mask with a one-way valve or whether we're using a full BVM. We have a partner with us that's going to help us with the rescue breathing, and in this case, Jody will be using the bag valve mask. Now, we're still going to call out to the patient, hey child, are you okay? Are you all right? They don't respond, so we tap and shout, are you okay? Can you hear me? They still don't respond. Now's the time we call 911, activate EMS, call a code, or send a bystander to go call 911 and come back with an AED if they have one. It's now at this time I'm going to assess for regular breathing and a pulse. Jody, this patient is not breathing normally and there is no pulse. I'm going to begin CPR. I draw an imaginary line between the nipples and place the palm of one hand on the sternum. If this is a large child, I'm going to use 2 hands. If it's a small child, I'm going to use 1 hand. That's a variation from the adult to the child in CPR compressions. In this case, he's probably big enough, I'm going to use 2. Now I'm going to do 1/3 the depth of the chest compressions at a rate of between 100 and 120 per minute, but we're going to change to 15 compressions for every 2 rescue breaths because we have 2 rescuers doing the CPR. So I'm going to do that now. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13 and 14 and 15. Now here's where we're approaching the 2-minute mark. And remember, with 2 rescuers, we're going to be switching out compressors approximately every 2 minutes so that we have a fresh compressor on the chest, able to ensure that 1/3 of the depth of the compression at a rate of 100 to 120 times per minute. So at the last set, before we reach that 2-minute mark, I'm going to say we need to switch, and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 10, 11 and 12, 13, 14, 15. He delivers the 2 more rescue breaths as I situate myself to the head of the bed. I take over the rescue breaths while Jody jumps right on doing chest compressions.
1, 2, 4.
He does 15 compressions.
10, 11, and 12, and 13, 14, 15.
I give 2 rescue breaths. 1 in, 2 rescue breaths in. He continues.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Now let's say 2 minutes has gone by again. He'll yell out the switch. I'll finish with the 2 rescue breaths. He takes back over on the bag valve mask. And I come back around and jump right back into doing chest compressions. So there's this minimization of pause between the switch, the rescue breaths, and the chest compressions so that we never leave too much time without somebody's hand on the chest doing a deep compression. This helps to bring the pulse pressures up. It helps to keep the blood pressure as high as we can with this artificial compression of the heart muscle, and it allows for us to ensure that this child has the best chance at survivability with the least amount of chance of brain damage that we can give them. It's this kind of teamwork that brings the high quality chest compressions that we're looking for to give our patients their best chance at a second chance at life.